Cervical spondylosis is probably ubiquitous. It happens to everybody after a certain age. And what we mean by cervical spondylosis is it is not just one disease or one condition, but it is a combination of changes that happen in the spine of your neck due to age-related wear and tear or degenerative changes, as we call them. And these changes can be multiple. These changes can happen in the bone, these changes can happen in the disc, this change can happen in the joints in the back of your neck, and also these changes can happen in the small bony foramina or what openings that are there in your spine. Now, depending upon the type of changes or depending upon the type of condition that affects the spine, patients usually can present with multiple symptoms. Now, the commonest symptom usually is neck pain, which is on and off, which is mild degree, which is mechanical, mild restriction of neck movements, which is not a very disabling type of neck pain in many cases. Now, only in a few patients where the cervical spondylosis is very advanced or very severe, in those cases, they can develop severe neck pain and severe restriction of neck movements, preventing them from doing their day-to-day activities. And sometimes it can also affect the nerve, which happens in a radiating pain that comes along your arm or along your forearm until the fingers. And it can also result in numbness or weakness of a part of the hands. So that usually indicates a severe type of involvement. Now, in very severe cases where the spinal cord gets compressed, in those cases the patients also develop difficulty in walking, imbalance while walking, unsteady gait, and also stiffness in the legs, difficulty in moving fast. If they try to move fast, they usually tend to fall down. So these kind of symptoms are very common in cervical spondylosis. Now, since cervical spondylosis happens in majority of the patients, majority of the population, now obviously you can imagine that in most of the cases it is very mild. In most of the cases it can be managed, prevented and maintained by doing regular exercises, taking precautions, taking care of good posture for the neck, doing regular exercises, avoiding stress and strain, bad postures, all those things. But only in some cases where the symptoms develop to a certain extent, like say for example pain that is radiating down the arm, numbness in the hands, difficulty in walking, unsteady gait. In those cases obviously they have to be appropriately investigated, the severity of the disease has to be found, and it has to be correctly treated. And most of the times they may require some sort of surgical intervention in order to release the compression on the nerve so that the nerve doesn't get damaged beyond a certain point and the function of the nerve, the spinal cord or the nerve is preserved so that the function of the patient can be maintained in a better way. Thank you.